So, what is anti-inflammatory agents? So, anti-inflammatory agents are the substances that will reduce the inflammation by inhibiting the inflammatory mediators like cytokines, prostaglandin, histamines, and leukotrienes. So, basically, they are classified into steroidal and non-steroidal anti-inflammatory drugs. So, in non-steroidal anti-inflammatory drugs, it will be like ibuprofen, aspirin, and the steroidal includes corticosteroids like hydrocortisone. So first of all, we'll move towards the glucocorticoids, which is the steroidal anti-inflammatory agent. So what does this glucocorticoids does in our body? So this glucocorticoids will bind to the will come and will bind to the G receptor protein in the cytoplasm. After binding to the G receptor protein, which is in the inactive form, the heat shock proteins like HSP90 or HSP70 will be liberated, and the G receptor protein complexed with the glucocorticoid will become the will activate, and this activated form will then translocate into the nucleus where it will be active where it will be binding to the glucocorticoid response element. After binding to this glucocorticoid response element, it will increase the gene transcription, where it will increase the level of the lipoprotein, while vice versa will decrease the expression of the COX enzyme. Now, this lipoprotein will then bind to the phospholipase A2 enzyme. This phospholipase A2 enzyme is responsible to convert phospholipid into the arachidonic acid. So this will bind to the phospholipase A2 and will decrease the expression of the arachidonic acid and eventually will decrease the inflammatory response. So this is how these glucocorticoids will decrease the inflammatory mediators response. So these are some of the drugs which are commonly used in the ophthalmological conditions. For example, prednisolone acetate, which is used for the post-surgical inflammation keratitis. Dexamethasone, which is also useful for the macular edema. Then fluorometholone, which is used in the mild anterior inflammation. So these are the some of the drugs which are used in the ophthalmological conditions. Now, coming towards the non-steroidal anti-inflammatory drugs. So what this non-steroidal anti-inflammatory drugs, what does they do is like when there is a damage in the cell membrane in our body, the phospholipids of the cell membrane will then convert into the arachidonic acid in the presence of phospholipase A2. Now, this arachidonic acid will then convert into the prostaglandins with the help of a enzyme cyclooxygenase, which is COX-1 and COX-2. Now, this NSAIDs will inhibit this COX enzyme and will decrease the conversion of the arachidonic acid into the prostaglandin, and eventually will decrease the level of prostaglandins. Now, the role of the prostaglandin is to liberate or to release the inflammatory mediators. So eventually, if we are blocking the cyclooxygenase, we are blocking prostaglandin, and at last, we are also blocking the release of the inflammatory mediators like thromboxanes and prostaglandin I2 or prostaglandin E2. So the major classification of NSAIDs, it includes non-selective COX inhibitor. So these are the agents which are not selective to any of the COX-1 or COX-2. They can bind to any of the enzyme. It includes like, for example, aspirin, ibuprofen, naproxen, mefenamic acid, and so on. There are some of the drugs which are preferentially COX-2 inhibitors, which include nimesulide, diclofenac, aceclofenac. There are also selective COX-2 inhibitors, and there are some of the agents which are analgesic antipyretic with poor anti-inflammatory actions, which includes our most common drug, paracetamol. So some of the drugs which are used for the ophthalmological conditions, it includes ketorolac, which is majorly used for the post-surgical inflammation. cystoid macular edema, prophylaxis, allergic conjunctivitis. Then diclofenac, it is used for intraoperative meiosis prevention. Then supro, suprofen, which is also useful for the post-surgical inflammation. The topical local anesthetics. So, what are the topical local anesthetics? So, they are basically uh, the agents which are applied directly to the skin or the mucous membrane to induce the temporary surface numbness. So, basically, these anesthetics are useful for blocking the pain sensation and also to perform some of the small surgical procedures. So, the major classification of the topical local anesthetics includes aminoamides and amino esters. So, these aminoamides include they have better stability, and example of these aminoamides include lidocaine, prilocaine, and they have duration which they have higher duration than that of amino esters. Amino esters, for example, benzocaine, cocaine, tetracaine, they have the shorter duration than that of amino acids. So how does this topical local analgesic act in our body? So basically, if you know that the in our body, the pain is sensed by the receptor called the free nerve endings. They are the first order neuron in the pain pathway. So these neurons get stimulated with when there is a mechanical stimulation or thermal stimulation like heat and shock or any other chemical stimulation. So this stimulation will lead to the opening of the membranes of this neuron, which will lead to which will allow the sodium and other cations to flow inside the cell and causing the depolarization. Now, what does this local anesthetic do? Is local anesthetics diffuse through the cell membrane and bind to this voltage sensitive sodium channel from the inner side of the cell membrane and thus prevent the permeability of this sodium ions and by just raising the threshold excitation. So this preventive measure, the prevent entry of the sodium into the neuron, thereby decrease the depolarization, and which will also prevent the generation of action potential in our body. So thus there will be no generation and conduction of the impulses to the CNS and will lead to the uh, local anesthetic condition. So some of the examples of the drugs which are used for these ophthalmological conditions are the proparacaine, which is used in a drop, 0.5% drop, and they are primarily used for the corneal anesthesia. Then tetracaine, lidocaine, cocaine. This all are also used for the various purposes like cataract surgery prep, diagnostic procedures, and suture removal, and so on. So, the uh, the next topic is the TR substituents and the wetting agents. So what does this TR substitutes are? They so just a second. So these tear substitutes are the topical preparation that replace or supplements the aqueous layer of the tears and improve ocular surface lubrication. So they basically include wetting agent, multiple action tear substitutes, and ocular surface modulators. So what does this wetting agent do? The wetting agents are the preparation that improve the spreading and retention of the tear film on the cornea and conjunctiva, and thus reduce the friction. So uh, this wetting agent will lubricate the ocular surface with limited residence time. Mainly, they are viscosity enhancers and the oil agents. The another is the multiple acting tear substitutes, which improves the tear film quality and quantity without significant ocular surface interaction. And it includes electrolytes and osmoprotectants. And the last one is the ocular surface modulators, which actively interact with the ocular surface to reduce the inflammation and promote the healing. So some of the example of the wetting agent include CMC, carboxymethyl cellulose, HPMC, then polyvinyl alcohol, then polyethylene glycol, which is commonly a re-wetting drop for prolonged dehydration. Then some of the example of multi-action tear substitutes include sodium hyaluronate, then rehalose, L-carnitine, electrolytes like NaCl, KCl. Thus, this will mimic the natural tear composition for the corneal health. Povidone iodine. So what does this povidone iodine is? This povidone iodine is a water-soluble iodophore that releases free iodine to rapidly disinfect the ocular surface through multi-target oxidation. So what does it do is like it irreversibly oxidizes microbial protein and DNA and achieves 96% of microbial reduction in 60 seconds. And it is a broad spectrum which can kill bacteria, virus, and fungi as well. So the clinical application of this povidone is in the pre-op surgery, conjunctivitis, neonatal care. And the last topic is the diagnostic agents. So these are the agents which are used to diagnose any damages is there in the cornea or not. So there are two type of stains which are majorly used. The first one is the fluorescein. This fluorescein is a eye stain which is used in the diagnostic procedure, and it is orange dye where it is used to detect the corneal damage, scratches, or any other foreign bodies. So what is the procedure behind this? Is like the doctor touches a sterile strip containing this dye to the lower eyelid, or it uses the eye drop, and then often combined with the topical anesthetic to minimize the discomfort. So whenever this strip touches the eyelid, the patient blinks to distribute the dye over the cornea. So after this, a blue light is shown into the eye. So if there is any scratches or foreign bodies in the cornea, then it will be stained with the bright yellow green color, and this can be graded with the various numbers like based on the intensity of the color, grade 0, grade 1, grade 2, and grade 3. The another one is it is also done in the same way as that of the fluorescent uh, stain. Thank you.